If you look at the state of skincare today, you are essentially looking at a landscape of wild, um, almost unbelievable extremes.
Oh, absolutely. It's a complete spectrum right now.
Right. Like if you scroll through your social media feed, you are bound to see people smearing like rendered beef fat on their faces.
Yeah, the beach tallow trend.
Exactly. And they are completely convinced they've unlocked the ultimate natural cure for everything from acne to aging.
Yeah, I mean, it is the pinnacle of the return to nature movement, where the assumption is just that if it came from an animal or a plant, it must be inherently safer for your body.
But then you step into a medical dermatology clinic, and suddenly you've left the farm and entered the realm of science fiction.
Right, it's a completely different world.
You are dealing with machines vaporizing human tissue with lasers, creating microscopic biohazard clouds in the air.
Which is terrifying, honestly.
Right. And doctors prescribing heavy antiviral pharmaceuticals just to keep dormant viruses from waking up and attacking your newly lasered face.
Huh.
I mean, the gap between what we think is happening to our skin at home and the intense biological reality of medical-grade dermatology is just staggering.
It is a massive disconnect, and that is where the danger really lies. We treat our skin like it's just a canvas we can paint over or sand down, when in reality it is a highly reactive, incredibly complex immune organ.
Which is exactly why we are diving into this today. Welcome to our deep dive into the surprisingly intense world of skin health, cellular repair, and clinical trauma.
Yeah, we've got a lot to cover.
We really do. Our mission today is to cut through the marketing noise and uncover the biological truth. We have pulled from a massive stack of sources for you. We've got clinical dermatology guidelines from Dr. Emma Craythorne's team at Clera, detailed breakdowns of aesthetic laser technologies, peer-reviewed endocrinology journals.
And even some pretty intense UK medical safety protocols.
Yeah, those are wild. We're going to look at how your skin actually heals at a microscopic level, what physically happens when you blast it with light, and the hidden, sometimes shocking hazards of clinical aesthetics that nobody tells you about in the waiting room.
It's going to be an eye-opener for sure.
Okay, let's unpack this. We have to start with the foundation, the daily defense. And I want to tackle this viral internet trend of using beef tallow as a daily moisturizer.
Ah, yes. The tallow.
People are literally ditching meticulously lab-formulated creams for rendered cattle fat. Like, why is this happening?
Well, the rationale behind it is actually rooted in a half-truth, which is, why it's so convincing for people.
Right.
Advocates claim tallow is highly compatible with human skin because its fatty acid profile resembles our own lipids, and functionally, it is a powerful occlusive.
Meaning it just blocks things.
Exactly. It forms a physical seal on top of the skin to prevent transepidermal water loss. So if your skin is dehydrated, it locks that moisture in.
But according to the clinical insights from Dr. Craythorne's team, taking that half-truth and slathering it on your face ignores the actual molecular structure of what you're applying.
Completely ignores it. What's fascinating here is that the skin barrier requires a very precise ratio of different fatty acids.
Because beef tallow is extremely rich in oleic acid, right?
Yeah.
Which is an omega-9.
Yeah, and the skin barrier isn't just a generic wall of fat. It needs a delicate balance between linoleic acid and oleic acid. Applying unregulated animal fat just throws that delicate cellular biology into total chaos.
Wow.
Think of the lipids in your skin barrier like the mortar holding the bricks of your skin cells together. Linoleic acid is structural. It's solid.
Okay.
Oleic acid, on the other hand, is highly fluid. And in skin that is acne-prone, inflamed, or has a compromised barrier, there is often already a severe excess of oleic acid.
So if you're breaking out and you apply beef tallow, you are essentially pouring more fluid oleic acid into a wall that is already crumbling.
Exactly. You're making it worse.
Is treating your face with beef tallow just because it's quote-unquote natural, kind of like using butter instead of mortar to fix a brick wall?
That is a brilliant way to visualize it. I mean, sure, it fills the cracks temporarily and makes it look smooth, but structurally, it's a disaster waiting to happen.
Because it's too fluid.
Right. You are introducing a chaotic, unregulated variable. When you add that much oleic acid, you increase the fluidity of the skin barrier so much that it actually creates microgaps.
Oh, yuck.
Yeah, pathogens get in, water escapes, and you cause massive congestion, which exacerbates conditions like seborrheic dermatitis. The natural fallacy is incredibly persistent.
Just because something is natural doesn't mean it's good for you.
Exactly. It doesn't mean its molecular behavior is compatible with your specific current skin biology.
And this highlights why dermatologists prefer to take absolute control at a molecular level, rather than relying on chaotic natural fats. Which brings us to the gold standard of controlled repair retinoids.
Oh, retinoids, the heavy hitters.
If you're listening to this and staring at your own vanity mirror, you probably have an over-the-counter retinol serum.
Yeah.
But the sources draw a huge contrast between those serums and prescription clinical topicals.
Yeah, it really comes down to cellular conversion. When you buy an over-the-counter retinol, it's a relatively weak molecule.
Right.
For your skin cells to actually use it, your body has to metabolize it. The retinol must be oxidized into retinaldehyde
Okay.
and then oxidized a second time into retinoic acid.
So it's a two-step conversion process.
Yeah.
And at each step, you are losing potency and relying on your skin's unpredictable chemistry to do the heavy lifting.
Exactly. And that takes weeks or even months to see any effect.
Yeah.
But prescription tretinoin skips that entire process.
Because it's already converted.
Right. It is already pure retinoic acid. So the moment it touches your skin, it binds directly to the retinoid receptors in your cells. It instantly instructs them to speed up turnover and boost collagen production.
But the sources are adamant that none of that cellular communication matters if you aren't protecting the skin properly from UV degradation.
Sunscreen is non-negotiable.
And the clinical guidelines on SPF are shockingly specific. It's not just about wearing it, it's the physics of how you apply it. 2 full finger lengths of sunscreen for your face and neck. And importantly, you are not supposed to rub it into your palms first.
Yeah, the palm issue is a perfect example of user error defeating a clinical formulation.
How so?
Well, the skin on your palms is incredibly thick and highly absorptive. So if you rub the SPF into your hands to warm it up, a massive percentage of the active UV filters gets absorbed by your hands before it ever reaches your face.
Oh, wow. So you're supposed to apply it directly to the face and pat it in?
Yeah, because sunscreen doesn't work by sinking in completely. It works by forming a uniform, microscopic film across the topography of your skin.
And if you aggressively rub it,
You break the film, leaving microscopic valleys of your skin completely exposed to radiation.
that's wild. But, no matter how perfect your topical routine is, your skin's ability to repair itself is actually controlled by a hidden internal architect.
Right, and this is where the narrative shifts from what we put on our skin to the systemic factors driving it from the inside, specifically hormones.
Yeah, the research in the World Journal of Advanced Research and Reviews detailing the role of estrogen in wound healing is absolutely profound.
It really is. I mean, we traditionally associate estrogen purely with reproductive health or, bone density.
Sure.
But in the context of dermatology, estrogen is the master regulator of the skin's biological repair timeline.
Let's break down the mechanics of that, because the journal outlines how estrogen controls the very first stages of healing hemostasis and inflammation.
Right. So when you get a cut or damage the skin, collagen from your damaged blood vessels is exposed. Platelets interact with that collagen to form a physical plug to stop the bleeding. That's hemostasis.
Okay, that makes sense.
And estrogen actively influences how that collagen is deposited. But the truly vital role is how estrogen manages your immune response.
What happens when the skin barrier is broken?
Your immune system panics and sends in neutrophils. Neutrophils are essentially the biological demolition crew. They rush in to kill any invading bacteria.
But they're kind of messy, right?
Incredibly aggressive and messy. They release enzymes that cause severe collateral damage to your healthy tissue.
So estrogen acts as the project manager stepping onto the construction site, telling the demolition crew to calm down and stop destroying the surrounding neighborhood.
That is the exact mechanism. Estrogen downregulates the inflammatory response so it doesn't get out of control.
Wow.
Yeah, and once the neutrophils are managed, estrogen helps monocytes transform into tissue-resident macrophages, which is the cleanup crew that eats the cellular debris.
And then it stimulates new tissue, right?
Crucially, yes. It stimulates fibroblasts to lay down new collagen and fibronectin.
I want to pause on fibronectin because the sources really emphasize it. If collagen is the bricks, fibronectin is essentially the biological scaffolding and glue that holds the repairing tissue together while it heals.
It is the structural framework. Without it, the new tissue lacks integrity. If we connect this to the bigger picture, aging isn't just about wrinkles. It's about the literal breakdown of the body's repair mechanism at the hormonal level.
So what happens during menopause when those estrogen levels plummet? The entire construction timeline must just derail.
It collapses. In menopausal women, that lack of estrogen means the demolition crew of neutrophils goes unchecked.
Oh, no.
Yeah, you get a delayed but massively prolonged inflammatory response. The body struggles to form a proper platelet plug.
So you stay inflamed longer.
Exactly. The macrophages are sluggish, meaning pathogen-killing capacity drops, increasing the risk of infection, and reepithelialization, the actual process of new skin growing to seal the wound, is severely delayed.
Wait, so without enough estrogen, your body literally forgets how to form a proper scab and close a wound.
The chemical signals simply aren't strong enough. It is why chronic wounds become such a massive medical risk in older populations. It perfectly illustrates why topical creams can only do so much if the internal hormonal architecture is failing.
Which brings us to the escalation of trauma. Because when topicals fail and the internal natural healing isn't enough to reverse severe damage, like deep wrinkles, solar elastosis, or intense acne scarring, patients turn to the heavy artillery.
To clinical resurfacing.
Right. If the body won't repair itself, dermatologists intentionally traumatize the skin to force that repair mechanism into overdrive.
We enter the laser room, we bypass the failing natural systems, and use physics to mandate a response.
And reading through the clinic breakdowns, there is a fierce debate between two main technologies, CO2 lasers and erbium lasers.
The laser wars, basically.
Yeah, both are ablative, meaning their entire purpose is to literally vaporize the top layers of damaged skin. But the way they interact with human tissue is completely different.
Very different. CO2 lasers are the traditional heavyweights. They use an excited carbon dioxide gas mixture to create an infrared beam that penetrates very deeply into the dermal tissue.
And that creates a lot of heat, right?
A ton of heat. Because of that extreme depth, the energy is absorbed not just by water, but by the surrounding tissue itself, generating an immense amount of thermal damage.
And that heat translates to a massive, dramatic immune response, which results in deep skin tightening and massive collagen stimulation. But the catch is the downtime.
The downtime is severe.
We're talking 7 to 14 days of looking and feeling like a burn victim. The skin is raw, oozing, developing heavy yellow crusting, and crucially, there is a major physiological risk here.
Yes, the hyperpigmentation risk.
Right. Because of all that heat, there is a very high risk of post-inflammatory hyperpigmentation,
All right.
especially for patients with darker skin tones.
The clinical guidelines always reference the Fitzpatrick scale here.
What's that?
The Fitzpatrick scale measures how much melanin your skin naturally produces and how it reacts to UV light. In higher Fitzpatrick types, meaning darker skin, the melanocytes are highly active.
So when you hit them with a laser,
When you introduce the massive, uncontrolled heat of a CO2 laser, those melanocytes panic. They pump out excess pigment to protect the area, leaving permanent or long-lasting dark patches.
so if a CO2 laser is like a complete tear it down to the studs gut renovation of a house, how does the erbium laser solve that problem?
Well, the erbium laser is a masterpiece of targeted physics. It operates at a specific wavelength, 2940 nanometers, that is highly absorbed by the water inside human skin cells.
Just the water.
Just the water. Because our skin cells are mostly water, the erbium laser energy is instantly absorbed by that intracellular water.
So it's essentially microboiling the cells. The water inside the cell flash boils, expands, and the cell pops and evaporates instantly.
A perfect description. And because the energy is so rapidly absorbed by the water, it doesn't have time to bleed down into the deeper, drier layers below.
Meaning less collateral damage.
Exactly. It generates far less collateral heat in the surrounding tissue.
So if CO2 is a gut renovation, erbium is more like a heavy cosmetic remodel, which means the downtime drops drastically to about 3 to 5 days. You get milder redness, faster peeling, and because there's less heat, the melanocytes don't panic.
Right. It becomes a much safer resurfacing option for those darker Fitzpatrick skin types.
And if we look beyond resurfacing the whole face, the sources detail how clinics handle isolated hyperpigmentation, like a sunspot or a tattoo. They don't use ablative heat at all. They use Q-switched or picosecond lasers.
Yeah, those are fascinating.
I found the mechanics of this incredible because they use photomechanical energy rather than photothermal energy.
Right, no heat.
They deliver energy in picoseconds, trillionths of a second. It's so fast it doesn't have time to create heat. Instead, it creates an acoustic shockwave.
It's exactly like an opera singer hitting the perfect note to shatter a wine glass.
Yes. The laser sends a sound wave into the skin that violently vibrates the melanin particle until it shatters into microscopic dust, which your body's immune cleanup crew then flushes away.
It is an elegant use of physics to bypass the dangers of biological heat.
It's amazing.
Right.
But This is where we have to transition to the dark side of this technology. Because if you are using an erbium or CO2 laser to vaporize human tissue, that tissue doesn't just cease to exist.
No, it certainly does not.
It turns into vapor. Where does it go?
It goes directly into the air of the treatment room.
Yeah.
And this brings us to one of the most highly regulated yet rarely discussed occupational health crises in dermatology, the plume hazard.
I was reading the UK Laser Safety Regulations, the Control of Artificial Optical Radiation at Work Regulations 2010. And I'll admit, my immediate thought was, don't doctors wear standard surgical masks all day in the OR?
They do.
Why wouldn't a regular surgical mask protect a dermatologist from laser dust?
It comes down to the physics of particle size versus the weave of a standard mask. When Class 3B and Class 4 lasers vaporize skin, the resulting smoke, the laser plume, contains particles smaller than 5 micrometers.
That's incredibly small.
Yeah, and a surgical mask is designed to catch large liquid droplets from a cough or sneeze. Trying to stop a 5-micrometer particle with a surgical mask is like trying to catch fine sand by throwing it through a chain-link fence. The particles pass right through, bypass the natural cilia filters in the doctor's nose and throat, and embed themselves deep into the alveoli of the lungs.
And what exactly is in that dust? The UK regulations highlight some terrifying compounds.
Well, because you are superheating organic matter, the plume contains toxic chemical byproducts. You have carbon monoxide, hydrogen cyanide, and crucially, polycyclic aromatic hydrocarbons, or PAH.
PAHs are the same carcinogenic compounds you get from the black char on burnt meat, or from vehicle exhaust, right?
Yes, and clinical staff are inhaling it all day. The risk of cancer for practitioners regularly exposed to laser smoke without protection is exponentially higher than normal environmental pollution.
That is terrifying.
But the chemical risk isn't even the most alarming part. The plume can contain viable biological pathogens.
Are you saying that getting a laser peel essentially creates a biohazard cloud in the clinic? Does a regular surgical mask do anything?
Absolutely nothing. The sources noted that researchers have cultured living E. coli from laser smoke.
You kidding?
I wish I was. They have found viable HPV, the virus, responsible for warts and cervical cancer. They've even found HIV DNA in the plume of vaporized tissue.
That is unbelievable.
The physical force of the laser blasts the virus into the air before the heat has a chance to kill it. You are essentially creating a biohazard cloud in the clinic.
Which is why the UK regulations mandate strict engineering controls. You cannot just wear a better mask. Clinics are legally required to use local exhaust ventilation, or LEV systems.
Yes, the LEVs are mandatory.
This is a high-powered medical-grade vacuum intake that must be positioned less than 2 inches from the patient's face to suck up the plume the exact millisecond it is created.
And it forces that smoke into high-efficiency particulate absorbing, or HEPA, filters. It is such a severe risk that clinics are legally required to appoint a laser protection advisor, an LPA, whose sole job is to audit these safety protocols and ensure the ventilation systems are calibrated.
Wow.
Yeah, without that LEV system, firing an ablative laser is an occupational hazard of the highest order.
But the trauma of a laser doesn't just create external hazards in the air. The intense physical shock to the patient's skin can actually awaken dormant hazards hiding inside the patient's own nervous system.
We are talking about the herpes simplex virus, HSV.
Right. It is estimated that a massive percentage of the global population carries HSV, the virus responsible for cold sores. It usually just sleeps quietly in the nerve ganglia. But a laser peel, especially around the mouth, is the ultimate biological alarm clock.
The trauma triggers immediate viral reactivation. And the Nottinghamshire Area Prescribing Committee guidelines exist specifically to manage this.
Because it's really dangerous on lasered skin.
Extremely. An HSV outbreak on a face that has just been freshly vaporized by an erbium laser is a medical emergency. The virus can spread wildly across the raw tissue, causing severe, permanent scarring, or even tracking up into the eyes.
So the standard protocol is to use antivirals, specifically Esclover. But I was looking at the 2 different routes of administration, and I have a serious question about the suppressive route.
Okay, let's look at the episodic route first. That is reactionary.
Right.
If you feel the familiar tingle of a cold sore coming on, you hit it with a short, aggressive course, taking a high dose of 800 milligrams within the first 24 hours to stop viral replication in its tracks.
Right, that makes sense for an acute outbreak. But if you are getting a laser treatment, the guidelines say they might put you on a suppressive route, meaning you take 400 milligrams of aciclovir twice a day, continuously, for weeks or even months before and after the procedure, just to keep the virus asleep while the skin heals.
That's correct.
My immediate thought was, Isn't it dangerous to suppress your immune system or take a heavy antiviral for months just for a cosmetic procedure?
That is a very logical concern, but it misunderstands how aciclovir works. It does not suppress your human immune system.
It doesn't.
No. Aciclovir is a highly targeted drug that only activates in the presence of a specific viral enzyme called thymidine kinase.
Oh, interesting.
It essentially tricks the virus into incorporating a broken building block into its DNA, halting replication. It is completely ignored by healthy human cells.
So it's like a smart bomb that only detonates if it finds the specific viral key.
Exactly. It is so exceptionally safe and well-tolerated long-term that the medical guidelines specifically state that the old practice of requiring regular kidney function blood tests for long-term users is entirely unnecessary for otherwise healthy patients.
That's really reassuring. The sources do offer practical self-help if an outbreak does somehow occur during recovery, though.
Yeah, pain management is key.
They recommend lidocaine 5% ointment to numb the extreme nerve pain and a simple barrier like Vaseline to keep the sores moist because dry scabs crack and scar. But they offer a very stern warning. Never apply ice directly to the skin to cool the burning sensation. Why is ice so dangerous here?
Because you are dealing with a barrier that has already been destroyed by a laser. Applying freezing ice directly to raw, compromised tissue causes rapid dermal injury, essentially instant frostbite.
Oh, this is awful.
It is. It severely damages the delicate new cells trying to form, massively delaying the precise healing timeline we just used the laser to initiate. You want cool compresses never freezing.
So what does this all mean? When you step back and look at the entire landscape we've covered today, managing skin health isn't just about finding the right cream or the most natural ingredient. It is a constant, high-stakes negotiation with your body's internal environment.
This raises an important question about how we balance intentionally traumatizing the skin for aesthetic gain without overwhelming the immune system. It reveals how much of modern dermatology is predicated on controlled destruction.
We strip the barrier with chemicals, we vaporize the tissue with focused light, and we use targeted pharmaceuticals to suppress the biological fallout.
Exactly.
To recap the journey you and I have been on today, we started by dismantling the myth of natural beef tallow, looking at how the fluid mechanics of oleic acid can shatter your skin barrier.
A classic natural fallacy.
Then we explored the invisible hormonal architecture of estrogen and how it literally acts as the project manager for your immune system's demolition crew. We mapped out the laser wars, contrasting the deep thermal heat of CO2 with the cellular microboiling of the erbium laser.
And the hidden dangers of the laser room.
Right. We uncovered the terrifying carcinogenic biohazards of laser smoke and why high-powered LEV vacuums are saving doctors' lives. And finally, we looked at how smart bomb antivirals keep dormant viruses from turning a cosmetic procedure into a medical emergency.
It's a comprehensive look at the extremes we go to, but I want to leave you with a final provocative thought to mull over.
I'm ready.
Throughout this deep dive, every single intervention we've discussed involves manipulating the skin through trauma or suppression. But your skin is already home to a massive, complex ecosystem, the microbiome.
Yeah.
It is covered in bacteria like Cutibacterium acnes, which we spend all our time trying to kill.
Right. It's a completely adversarial relationship.
Well, what if the future of dermatology abandons destruction entirely? Synthetic biologists are already looking at ways to genetically engineer the bacteria that naturally live on your face.
Wait, really?
Yeah. What if, instead of vaporizing your skin to stimulate collagen, we reprogram the DNA of your C. acnes bacteria to secrete human collagen directly into your pores?
That is insane.
What if we code them to produce localized estrogen or secrete biological UV filters for us?
That is mind-bending. Instead of tearing down the house and forcing the body to rebuild it, you just genetically reprogram the microscopic tenants already living on the surface to act as a 247 living skincare factory.
It would completely eliminate the need for the lasers, the toxic plumes, and the severe downtime.
A living skincare factory. That is an incredible thought to end on. Well, thank you for joining us on this deep dive. Whether you are carefully padding in your 2-finger lengths of SPF tomorrow morning, or considering a heavy cellular remodel with an erbium laser, we hope you keep questioning the actual biological mechanisms behind these everyday routines. Because when it comes to the complex organ that is your skin, you don't want to be splashing around in the muddy waters of marketing. You want to understand exactly what is happening at a cellular level. Catch you next time.